Hello, my name's Carol. I'm practice pharmacist at Westmoreland Group Practice. I've been employed by the practice for 8 years, but I've been a practice pharmacist for almost 20 years now. I work with a team including 2 other pharmacists from the primary care network and 2 prescription clerks. We process all of the repeat prescriptions that come in through the surgery and deal with any queries that may arise from them. We work closely with the GPs on prescribing issues, as well as liaising with our colleagues in the local community pharmacies. Practice pharmacists have pre-bookable appointments every day for medication reviews, where we can review patients' problems that they're having with their medication, side effects or compliance issues, and we can obviously remove any medications that are no longer required. I'm also an independent prescriber, which means that I can sign off prescriptions myself. Area of practice for that is the management of hypertension. So my colleague Sharon and I work closely with the doctors to manage all of the patients with blood pressure problems within the practice. With medication reviews, the pharmacists assist the doctors. We can look at any problems a patient may be having. That may be a side effect from their medication, and we could make any relevant changes to resolve that problem. We can also help, there's lots of supply problems in the UK pharmacy chain at the moment, so often medications are unavailable and the pharmacist is generally the first step to resolving that and prescribing an equivalent alternative for the patient so their supply remains uninterrupted. And finally, we might also be reviewing medication and find that the patient isn't actually using that medication anymore, yet has a stockpile at home where they have gradually built up but they haven't taken the medication, so we can remove from their repeat prescription and stop the wastage for the NHS. By consulting with the practice pharmacist, you are often freeing up appointments with the GPs to let them deal with some of the more complicated issues that a patient may be facing. The pharmacist has a great knowledge and skill set around medications, and we're well equipped to deal with the majority of the problems that the patients may have with their medications.